An overview of hemorrhoid by Praveen Gupta, Nagpur, India. Piles or hemorrhoids can be described as masses or cushions of tissue within the anal canal. They are present from the birth. It is currently thought that cushion arrangement of hemorrhoid enables to ensure fine occlusion. Are normal anatomical structure. Only when become disease they are called as hemorrhoidal disease. This is the pathophysiology where the sliding theory is most commonly accepted one. Half of the population over 50 years is suffering from the disease. Presenting towards the rectal side are internal hemorrhoids, outside the anus are external. What are the causes? The causative factors including enema, suppository, horse riding, menses, oral contraceptives, spices, chilies, drinks, alcohol. Symptoms include pain, bleeding, anal swelling, pruritus, anal discharge, and disturbance of rectal emptying. Grades are grade 1, 2, which do not prolapse but bleed. Grade 3 prolapses. Grade 4 permanently remains outside the anus. So this is a grade 3 hemorrhoids where 3 hemorrhoids can be seen projecting at the anal verge. This is the grade 4 where you can see the external component along with the prolapsed hemorrhoids. Symptoms of grade 1 and 2 are bleeding and discomfort, while 3 and 4 are prolapse, discharge, soiling. Diagnosis is purely clinical. It is seen then felt. Can be examined in a left lateral position or knee elbow position. First, inspection and palpation of the anal canal. Proctological examination is well tolerated and is done in the patient's convenience. So these are the position 11, 7 and 3 o'clock positions. Complications include anemia because of excessive bleeding, infected and ulcerated hemorrhoids as seen here. This is hemorrhoids can become gangrenous because of prolapse and thrombosis. They can get infected and suppurated. They may have polypoid growths. There may be fibrotic bands which could be mucosal. Sometimes there is acute thrombosis in internal hemorrhoid called as acute attack. It don't spare even young boys. Symptoms of external hemorrhoids, they are felt as bulges leading to pain, cause anal lump which is very painful and requires surgical evaluation or evacuation. Primary treatment, avoid constipation, softening of the stools. The various food which has been advocated. Diarrhea should be controlled with fibers. Over-the-counter products are very popular. They reduce the symptoms of hemorrhoid. Then drug therapy include euphorbia prostata, flavonoid derivative and calcium dorbicillate. Local treatment in various forms of ointment, cream, gel, suppository, foams and pads. Then localized anesthesia, drugs causing vasoconstriction. Instrumental treatment include injection sclerotherapy, rubber band ligation, cryotherapy, etc. These procedure causes reaction in the hemorrhoidal tissue which heals by scarring. So sclerotherapy is one method where injection in the base of the hemorrhoid is given. The disadvantage include discomfort, bleeding, resistance to injection, infective complication. Then most popular one is rubber band ligation which encircles the base of the hemorrhoid. Disadvantage, intolerance, severe pain, bleeding or infective complication. Then heat is used to kill hemorrhoids. Pain is probably less than banding. The various methods include infrared coagulation or photocoagulation. Then comes the bipolar electrosurgical device causing then radio wave ablation of hemorrhoids which causes minimal lateral thermal damage. So this is the way by which radiofrequency ablation done in situ of the hemorrhoids. Then for advanced grade, fixation after ablation. So this is easy to perform but may lead to certain minor complication. Then comes the ultravoid or direct current electrotherapy to treat internal and mixed hemorrhoids. No anesthesia required, but very lengthy. Then comes the freezing or cryotherapy, which is no more used now. Surgical procedure include hemorrhoidectomy, which could be open or closed. Hemorrhoidectomy done using lasers or hemorrhoidal ablation using laser, then hemorrhoidectomy using ligature or harmonic scalpel. Doppler guided hemorrhoidal dearterization, which identifies the individual artery supplying the hemorrhoid. Then stapled hemorrhoidectomy or hemorrhoidopexy, which is also known procedure for prolapse and hemorrhoids. It needs a learning curve, costly. So in a nutshell, apart from careful medical history, rectal and endoscopy examination is a must. Hemorrhoids patients seeking doctor's help are very late. Reassure the patient. There are wide range of treatment methods. The multiplicity treatment shows that none is greatly superior to others. Each practitioner therefore must be in a position to offer greatest possible range of treatment option, not to be slave. If such instrumentation technique are unavailable, there is a risk. Surgery is painful, accompanied by morbidity, and difficult for the patient to accept. Surgery should be considered only as a last resort. Each practitioner therefore must be in a position to offer the greatest possible range of treatment options. Thank you.